Well, it is very humbling and very gratifying, and it's an incredible honor. Um, to be selected by one's peers is, of course, particularly special because everyone on that selection committee is a very accomplished individual. So it is very meaningful for me. And of course, it's a recognition to the accomplishments of our group, not just me. When I was still a resident in internal medicine, I was in Cleveland, I remember, and these were the very early days of oncology. And we used to, while making rounds in the hospital, we almost always bypassed the rooms of patients with cancer because there was so little to do, and our attending physicians and our teachers didn't really have much to offer. So that piqued my interest, and then I just happened to take care of a couple of young women with metastatic breast cancer, and that really presented to me the incredible challenge and the incredible opportunities of focusing on cancer research, and especially breast cancer research. So when I arrived to MD Anderson for my fellowship, the first day of my fellowship, after I figured out, where the hallways led, I made a beeline to the office of the then chief of the breast service and told him that here I was, and while he didn't know me from Adam, that's where I was going to be. Well, we have made considerable strides in both early diagnosis and management of breast cancer. And over the past 40 years, we have reduced mortality from breast cancer by anywhere from 30 to 50%, depending on stage and specific subset. We have learned an incredible amount about the basic biology of breast cancer, about the various subsets that now allow us to focus on different types of breast cancer that require different treatments and with which we have various levels of success. And it is that information that is leading us now to the next step which I believe will be the development of increasingly personalized approach to treating patients. Up until about 20 years ago, we treated every patient with breast cancer the same way, one size fits all. Over the past 10, 15 years at least, we've been treating the hormone-dependent breast cancers differently from the hormone-independent breast cancers. But now we have agreed on a number of subsets that are discrete and that require different interventions. And while there's a long stretch between now and truly personalized care and research, I think we are heading in that direction. And our institution is really poised to make major advances in that direction.